Assalamualaikum everyone and hi, I'm Epistemophilic. Welcome to this lecture series. In this series, I'll teach you general anatomy starting from anatomical nomenclature. Anatomical nomenclature refers to all the series of rules that we follow during studying anatomy. Comprising of the 5 steps, the first one is anatomical position, planes of the body, then comes terms of position, terms of laterality, terms of movements. We will discuss first 2. Anatomical position. A body is said to be in anatomical position when it is standing erect, eyes looking forward to the sky or horizon, upper limb hanging by the side, palms of the hands are directed forwards, but the feet are together with toes pointing forwards. The second point of discussion is the planes of the body, including the 3 main planes: median plane, coronal plane, transverse plane. Median plane, also known as sagittal, parasagittal, or paramedian plane. Coronal plane, also known as frontal plane. Transverse plane, also known as horizontal plane. Let's talk about the details of these planes. Median plane is a vertical plane that divides the body into right and left sides along the midline. Coronal plane is a vertical plane that divides the body into side to side. It is at right angle to the median plane. Transverse plane is a horizontal plane that divides the body into upper and lower regions, and it is also at a right angle to both the planes discussed before.